Let's talk about who's in jail. 80% coming in have a substance abuse history. A large percentage have mental health disorders.
They have diabetes, high blood pressure, heart failure, asthma. The list goes on.
For many individuals, correctional facilities are the only place where they're really getting consistent health care.
If we're trying to reduce healthcare costs, if we're trying to improve healthcare quality, this population can't be ignored.
We have to reframe our thinking about the role of jails and the health care that's provided in jails.
I'm an angry family doctor, and I'm sick and tired of patients getting bad care. And my patients in Camden got bad care. I did the best I could to deliver good quality care, but when they stepped outside my office, there were all of these other forces that I couldn't control. The city of Camden is 79,000 people. It is one of the most dangerous cities in the country. We're one of the poorest cities in the country as well. Camden's an extremely violent place. You hear a lot of gunshots in the evening. Camden's where you come to buy drugs.
Camden is a population of people who are working class folks who have the misfortune of not necessarily being able to find work and really have some serious socioeconomic issues.
Most people in the Camden area, one of the poorest areas in the United States, repeatedly return to the emergency room seeking primary care.
High utilizers are folks that are going every day to the emergency room, every day to the hospital. They have very complex medical and social issues.
Many of those patients cycle through the jail, whether it's for 15 days, for 30 days, for 6 months.
We have one woman who comes in all the time who has come back a lot because she doesn't have any of the social supports.
Part of what we need you to do to help yourself, Chanel, is to make those telephone calls yourself. Okay.
They're severely mentally ill. They don't have Medicaid.
I'm sorry, love. Have you gone and talked with any of the therapists that we asked you to talk with?
They've exhausted some of their welfare. Their family can't lend them the money they need for any type of medication.
Last time when we went, they said somebody canceled the appointment.
How can you really manage your diet when you have diabetes and you're homeless and you don't have any money for your medication?
I'm gonna check in with Dr. Byrne, okay? And I'll bring you back the info for the therapists.
These are really some of the most vulnerable populations that need the help the most, and they're part of our communities.
Over the years, we found that a significant number of the patients in Camden that are going to the emergency room and hospital over and over also end up in jail as well. The jail is a whole nother part of the healthcare delivery system.
Let's say I'm unstable when I come in the door. Somebody has to identify what my real condition is.
Are you under the influence of any drugs or alcohol?
My real diagnosis and my real medication.
You have a serious illness.
Might be trying to call the various pharmacies to see if they have any records of this person. Most jails are still operating with hard copy medical records. You've got rooms with volumes and volumes of paper records.
They do CT scans, they do MRIs, they do very costly procedures to try to figure out what is going on with this inmate. All the while, the person is decompensating, the person's getting worse. They could be really wreaking havoc in the jail and causing a lot of extra security, a lot of resources being spent trying to solve a mystery that is a couple clicks away.
About a year and a half ago, we went live with a system that took a lot of work to put together, and it's a health information exchange.
Health information exchange is basically a big database of information.
It is a web-based view for any provider in the city that ensures that doctors and nurses and health providers have seamless access to people's medical records.
It feels fantastic to know that I can look in the computer, pull up the labs or the report, and do whatever the next step is that's needed for their care. But the HIE hasn't been extended to the jail systems.
Right now, there's no communication between primary care provider and medical staff in the jail. Literally, the jail is cut off from medical society, so that patient disappears.
We often have no idea what's been done for them when they're in jail, what medications were started in the jail, and what new medical problems occurred while they were in the jail. So for the provider community, this is incredibly frustrating.
That disconnect is tremendous, and it has serious implications across the board. It increases the overall cost to the jurisdiction, because now I'm paying double. I'm paying for something that might have been done in the community, and I'm paying again for it being done in the jail.
I find it, mind-boggling that we can transplant organs and do open heart surgery, but that we can't do simple things like share data.
The overall goal here is connectivity. We're trying to create bridges from that island, which has been corrections, to the community.
If they had access to the HIE within 2 minutes, the intake staff could really get a good understanding of this patient.
It simplifies the screening and intake processes, provide real-time information with regard to pharmaceuticals. There's a direct healthcare benefit. It improves public health.
The HIE is helpful in a primary care office. It's critical in the jail.
I think the value of health information exchange is rising with accountable care and the new models. But once you have the cost and benefit equation right, information can flow at the speed of trust. What it's going to really take are leaders in the correctional facilities who can blaze the path and demonstrate it and talk about it and show others how it's done.
The story of healthcare in America is really that good doctors and good hospitals go to work every day and deliver a disorganized and fragmented product. We're taking really vulnerable sick people and not taking good care of them, and we're spending a lot of money in the process. I can't think of a bigger ethical and moral catastrophe. We're going to be in a terrible moment where we either ration care or we fix the delivery system.
Your mom, plan it out.
Figuring it out, one patient at a time, one jail at a time, one community at a time. Embracing patients who have been in jail and been in prison is the right thing to do as a society. And it's a smart thing to do.